It's really an honor to be here and present the Ukrainian situation. Unfortunately, it's not so, might be not so good. That is why we are on the first line, and we are on the first line of epidemic. So I will be brief, and I will even start my watch. Yeah. Okay. So some general figures regarding the whole this range of epidemics. As you know, Ukraine is suffering the one of the worst HIV/AIDS epidemic in this part of the world, and this is why, because the reasons of the infection are common. So we have the same problems with hepatitis C, and HBV is also an issue. So the prevalence of HIV in Ukraine, regarding on the data for 2015, it's almost 1%. Annual incidence is also going up, and it's 0.7 for the last year. And we have officially registered, according to official registered data, we have almost 300 HIV cases registered in Ukraine. HBV prevalence is about 1.5%, and annual incidence, as you see, 3 cases per 100,000 people. Unfortunately, we do not have a unified register of HBV and HCV statistics. It's one of the gap of our policy and registration issue. So HCV also we do not have, because we do not have statistics, we have just estimates, and according to these estimates, we have more than 5% of prevalence of HCV, and the annual incidence, it's somewhere about up to 65%, but in some regions of Ukraine it's even up to 92%, as I know as figures. Also, unfortunately, we do not have a statistic for HIV, HBV, and to HCV co-infection, but you can find some figures and estimates available, and we can prove some data within our researchers. Main risk for transmission is, according to the statistic, 73% are related to sexual transmission, and at the moment it's 22% related to drug use. And we have about 310,000 people who use injection drugs. It's the main problem, and it was the reason of HIV epidemic and the HCV epidemic in Ukraine. Sharing injection equipment, and it's still the issue. But now sexual partners of people who use drugs, injection drugs, became more dangerous issue and the reason for scaling up the epidemic. And the MSM group in Ukraine is unfortunately became the key hidden population in order to reach with prevention services, and it's our priority group now with prevention work. HBV, prevalence among people who use drugs is about 5.5%, and as I told, HCV it's about 55%, but in some regions it's more than 90%. What we're doing, and we have some success, and in order to reach this more at-risk population, we have been implementing the biggest harm reduction program in this part of the world, and cover 280,000 key populations, and most of these our clients, 212,000 are injection drug users, and we are providing with whole range of services, consultancy, consultation, prevention, condoms, syringes, opioid substitution treatments, almost 9,000 people on treatment. Pharmacy-based intervention, we implemented city short-term intervention for people who use drugs in order to start RT as soon as possible. Testing for STI is also available, HBV vaccination, and we're already implementing HCV treatment with DAA, and there I'll mention some figures later on. This is the map of Ukraine, and kind of just to remind, we have 45 million population, and kind of those part of Ukraine where kind of the color is brighter, the problems there are also kind of serious. So that is why there are most our services, harm reduction services, available there, and we reach more people at this part. Actually, to mention that we have, as you know, we have the acting war conflict on the eastern part of Ukraine, and Crimea is occupied by our former good neighbor, but we're still providing harm reduction services in all these territories. Harm reduction available in Donetsk and Lugansk and in Crimea. Unfortunately, there is no OST treatment anymore there. So some statistic regarding treatment and coverage, whatever. The number of patients receiving ARV in Ukraine is almost 70,000 people, and almost 45,000 people got ARV treatment from the state budget, and still 23,000 provided by the Global Fund, and but the figure that the government responsible for is going more scaling up. So the type of medicines you can see, and funding allocated, it's about 160 million for the state budget. But it's also not enough to cover all needs. We have the timeline. It's according to the government program. You see that the HBV, HCV treatment, we have the government program should be closed down by the end of this year, and unfortunately, the HCV hepatitis program is underfunded by over 85%. It's really a shame, and now we are working hardly to increase this, not increase this figure, but increase government responsibility to treat all these people who are in need. Starting from 2012, we launched the huge advocacy campaign, information campaign to get people aware about the problem, and to get our policymakers and government aware that they need to deal with this problem. And we have some really good results, some already more than 1,000 patients already on treatment provided by Alliance through the Global Fund money, and we're already going to start with the second generation DA treatment. We got the lowest price from the manufacturer for this treatment, and according to the national program, you can find some data. So from the government budget, we have about 5,000 people got access to treatment. Unfortunately, we do not have any information about the results and some data. You can find some particular information regarding the regimen, whatever. And what we are responsible for, it's our own program. You can find below our coverage, the treatment available in 17 regions, and more than almost 1,200 people on treatment, and 78 people on treatment, they have co-infection with hepatitis C, and we have 93% of positive response of this treatment already provided, and going to scale up our treatment It's just some figures. We started from 2012 with kind of general testing, national campaign, kind of 4,000 people were tested, kind of dedicated to the World Hepatitis C Day. And kind of there were almost 12% of positive results of the hepatitis C were positive, and we use this as an instrument to cover, to start treatment. So it's our program and our coverage with some data particular. Here you can find the what type of treatment outcomes according to the genotype and regimens, some particular data, and thanks to our NGOs all Ukraine, they are responsible for implementing, and our partners from the hospitals, from aid centers, from some clinics who are involved in this program. So this data, again, regarding particular results and some statistics related to these epidemics. Unfortunately, again, so we do not have precise statistics from the government, but at least we can use our data according to our. So this slides is really small figures, but kind of you can find it later on some kind of particularities related to the state program, alliance program, and kind of private sector, what we are going to do, and in order to scale up our treatment and to get more people that the treatment should be accessible for more people in Ukraine, and we should cure this problem and evaluate it as we hope. So I would thank my colleagues who were kind of involved in the preparation of this data provided, and thank you very much, and I wish you the good and kind of good results for this conference. Thank you.